Good morning and welcome to RF Breakthroughs. Thank you for joining us. My name is Kevin O'Neill. I'm Director for New Frontiers at the Rockefeller Foundation. We're here today to talk about the access to the safety net benefits in the United States. This emerges out of Rockefeller's work to expand economic opportunity to all via public policy, and as well our work to use data, technology, and machine learning for social impact. The foundation has been working to support organizations that were carrying out the research and advocacy needed to expand programs to help working families. Programs like the Earned Income Tax Credit and the Child Tax Credit. But as we dug into that work and worked with grantees, we learned that not everyone who needs help and is eligible for help gets it. In the case of the Earned Income Tax Credit or the Child Tax Credit, as many as 20% of families who need it and are eligible don't get those life-changing supports. But for other programs, non-participation is even higher. In the case of the Women, Infants, and Children's Nutrition Program, as many as 45% of people who are eligible and need it don't get basic nutritional support that the federal government makes available. Up to $65 billion of benefits go unclaimed each year, all of which could change a life and could change our society for the better. We know that younger people, younger families, people of color, immigrants, and people with other barriers in their life are less likely to get the help they need. This is a problem that data, technology, and design can help fix. It's also a problem that we can make progress on now without waiting for legislation or bigger changes. It's also the case that COVID-19 has been a perfect storm, not only for people in need, but also for those in government and outside of government who are trying to help them. Never have so many people needed help in such a short period of time as unemployment reached over 13%. While there were new programs from the CARES Act to help people, these also created new complexity and confusion, both for people seeking help and for the dedicated public servants and social workers trying to help them. It also closed offices and forced remote operations. At the peak of the pandemic, over 75% of Americans were under stay-at-home orders, meaning they couldn't reach offices to get help in person, and also that social services providers were needing to close down offices. We're going to dig into the successes and failures both during the pandemic, before, and beyond. And we're going to look at some of the leading innovations and leading innovators who have been tackling this problem. We have a live audience today, so please follow along with us on using hashtag RF Breakthroughs on your favorite social platform. And we're also taking live audience questions for our panelists. So please throw those into the mix as well. I'm honored to be joined today by three leaders who have been tackling this problem from different perspectives. Innovating not just to fix access problems, but actually put forward a new vision of what the safety net could look like. We have with us Robert Gordon. Robert is director of the Michigan Department of Health and Human Services, one of the agencies that has been tackling not just the health problems created by the pandemic and other problems, but also the economic and social problems in its wake. Robert also has an illustrious record of service in both federal and state government before becoming director. We're joined by Janette Fong. Janette is product manager at US Digital Response, one of the most exciting new organizations to spring up to respond to the pandemic. And Janette comes to us with a strong background in consumer tech, and has scrubbed into government for the first time to serve. We're also joined by Trooper Sanders. Trooper is the CEO of the Benefits Data Trust. And we'll dig into each of their perspectives and how they're tackling this problem and what they think the future looks like. Trooper, I'd like to start with you. What's at stake here in terms of human impact? And can you tell us a little bit about what BDT is doing to make that impact?
Absolutely. Well, ensuring that everyone who is eligible for benefits is actually tapping them if they choose to is really, frankly, the difference between life and death in some circumstances. economic security, but also the nation's long-term economic growth. I start with life and death because through EDT's work around seniors accessing SNAP, or what used to be called food stamps, some of our research has shown that getting a senior who's eligible for SNAP that assistance and their ability to buy a better bag of groceries puts them in a better place and can potentially delay when they need to enter a nursing home. And we're in the middle of this pandemic, and we know that nursing homes and care homes have been an epicenter of mortality. And it's just unacceptable to think that in the United States, there are seniors who have died from this condition, from COVID, and who are at risk today, who, if we had gotten them SNAP a couple of years ago and gotten them in a better shape, they might be sitting at home fussing with their family about not going out for their weekly coffee outing with their friends. But for other people who are struggling not only to make ends meet, but really just to keep any sense of life together during this pandemic, benefits can really make the difference and allow people to buy food and keep their homes heated during the winter and to get health care and provide just that bit of support that can help them get through day to day so that they can figure out their path ahead. And then for those of us who don't claim benefits directly, let's keep in mind that these are dollars that flow through our healthcare system and our stores. So it might be our local grocery store that's kept in business because of SNAP. And it might be the workers who we need, who have been supported through these benefits to get through school or to get their kids through school, to get on the track to create, to fill the types of jobs that are going to power our economy in the years ahead.
Great. So, Janette, I want to turn to you next. U.S. Digital Response was formed in direct response to the pandemic. We heard from Trooper about this, what's at stake here. What were you seeing and hearing from your partners in government during the pandemic? And what was U.S. Digital Response's role in overcoming those barriers?
First of all, Kevin, thank you for having me, and thank you to Rockefeller Foundation for having us. You're right, U.S. Digital Response is a fairly new organization. We're made up of technologists and civil servants, former civil servants. It's our goal to serve the public by partnering with government agencies to help them scale their programs through technology. And Trooper's right, this is all about access to benefits. And in a time like COVID, especially when we think back to March and April of last year, when so many communities were under lockdown, what government systems were experiencing was a time of stress. What government teams were experiencing was a time of extreme stress when, for example, unemployment systems and were being stretched thin by a month-over-month increase in applications of up to 30 times what they were seeing in prior months. And we were seeing that these systems were struggling to accept applications, to field the phone calls that were suddenly flooding their systems. We stepped in, for example, with a partner in the state of Kansas to help them understand and troubleshoot why their unemployment systems, why their websites were going down. Now imagine this, you find yourself out of a job, you have a vague notion that you can get unemployment insurance, and yet there is no way to apply. You cannot find a way to apply. That is probably the most frustrating and stressful thing that you may be going through. So we put a volunteer who worked with the Kansas Department of Labor to troubleshoot and advise on what was really going on, what was bringing their system down. And we found that despite the initial thought that it was their mainframe systems, it was actually a simple problem where we could stand up a content delivery network to support that system, and ultimately got it back up.
Great, thank you. Robert, I know you're going to have to leave us a little bit early to join the governor for a press conference, but I wanted to, you've thought about access to benefits as much as anyone on the planet, I think. And how are you thinking in 2021 with the options we have on the table, with the lessons of the pandemic, how are you thinking about access to benefits, and how is the Department of Health and Human Services in Michigan approaching this problem?
Yeah, thanks for asking. Wonderful to be here. I'll tell you all, I'm in the Michigan State Capitol, which is more famous than it used to be, and hence the mask. It's wonderful to be with you. I think with the new president, we have an amazing opportunity to expand the social safety net. But we know that it matters not only how many benefits we deliver or how much, but also how we deliver them. And that matters for who is actually able to access benefits. So questions I always want to ask are, do we help families get the help they need, or do they make them reach out to us? Do we make the process of getting help as fast and painless as possible, or do we make it hard? And overall, cutting across everything we do we deliver benefits in a way that treats people as equals, deserving of respect rather than suspicion? These can sound like platitudes, but they are very meaningful in their impact on our work. I'll talk about 3 ways they matter. First, we have focused in Michigan on getting rid of rules that emphasize precise targeting over ease. For example, we've adopted standard rules for medical and housing deductions. Targeting becomes a little less precise, but it's easier on our resident, and it also lets our staff process benefits more quickly. These are familiar issues, by the way, if you're thinking about vaccine distribution right now. Second, when it comes to preventing errors and fraud, we focus on demanding less paperwork from folks and relying more on analytics instead. So a quick story, we raised asset limits in Michigan. People were supportive of the policy, but just as important was a process change. We said that residents could self-attest rather than having to bring in a bank statement. We had justified the bank statement requirement because there was a story about a guy in a Hummer who got SNAP. And the guy shouldn't have gotten SNAP, but the question was how many thousands of Michiganders had to spend thousands of hours so we could stop one guy with a Hummer. And there's better ways to do it. That's what analytics are for. That's what data from the IRS are for. We don't need paper from everyone. And the last thing I'll talk about is the ways that we have operated because of the pandemic and in our data. So we went through a very similar process in the pandemic. We no longer could have people bringing in documents to us. They didn't have a letter from their employer who wasn't going to their work, and we didn't want them coming to the office. So we said, it's okay, you can self-attest. We made that decision early. Because we made that decision, we had more rapid and larger growth in SNAP participation than many, many other states. I will do just one more quick comment. I think in all of these things, there's a core moral commitment, which is to see the work, to see what you do as a state official through the eyes of the residents who you serve. So user-centered design, and this is important to BDT, it's important to the US digital response. User-centered design can seem like a slogan, but for us, it is actually a core work principle. It is about empathy, it's about respect for people, their time, their perspective. And so, for example, we have simplified our applications, we've cut how long they are, we've cut renewal applications. And because of those things, actually, we save people time and we get more people getting the benefits that they need. So I will stop there, but those are some of the things, some of the ways that we pursue this mission. Not only having generous benefits, but also having benefits that people can actually access in real time.
Absolutely. I think that's a great framework of empathy over bureaucracy, ease over targeting, analytics over paperwork. Trooper and Robert, I want to dig into this. I know for both of you, the idea that the safety net can reach out to you rather than you reaching out to the safety net is something you've both worked on and a principle that has guided you. I think it's also a little bit of a quantum leap in terms of how we really think about the safety net and how we think about caring for our fellow Americans. Trooper, I'll ask you first, and then Robert, let you follow up. Like, what does this look like in practice, and how are you doing it?
Sure. So I think really it's about getting back to the exercising a bit of social justice originalism and getting back to the original intent of why we went through made the political decision and made the hard-fought political decision to create these programs to begin with. We created programs such as Medicare and Medicaid, Pell Grants, WIC, because of the extraordinary suffering and poverty that was going on across the country. And we made a decision that we are not that country to allow that type of suffering to continue. And so we had the political debate. The political debate decided that we were standing up these programs. But then, frankly, we lost our focus in creating the infrastructure and operations and mechanics of how to operate these programs. And look, it's important to be very careful with the public's money, but we put the vault at the center of these programs as opposed to the person. And we built rules and processes and procedures to prevent fraud and those who should not get these benefits from getting them. But it overcorrected. And as Robert said, we put so many things in place so that one person who was not supposed to get it didn't get it, but it made it much more difficult for hundreds and thousands of others to get them. And so I think we really need to go back to that original purpose and putting the human in the center of this and really think about some common sense things. How would we want to be treated if we were dealing with these programs? Frankly, how do we want to be treated when we're just going about our life, going to the grocery store, enrolling our kids in schools, et cetera? And so we can have accuracy in enrollment and also make sure that it is efficient and works better for people. And that is, yes, using data and technology efficiently and effectively. But a lot of this is about leadership. And I'll just have to brag. I am from Michigan, and so it's great to have a Michigan leader on here. And I'd be remiss if I didn't say go blue. But this is about leadership. This is about values, and then this is really about thinking about both the individual who needs the benefits, but then the frontline workers who show up to work every day intending to help as many people as possible. And how do we get out of their way with unnecessary rules and regulations and blocks to make things easier? And I'm really proud that, BDT, we see our role as really being a helper and an ally of the public servants who are charged with administering these programs. And so whether that is helping to directly screen and enroll people, and we did 60,000 of those last year for benefits, or providing advice and technical assistance to government leaders and others on what they can do, or working with sectors such as healthcare that has so many people under their care to help them access benefits. We want to be as helpful as we can and a great ally in this.
Good. And I know from conversations with your data science team that you're also, actively reaching out to people who are coming off unemployment. You're actively reaching out to people who are coming out of the hospital to make sure they have the support they need to not be readmitted to the hospital. So I'd love to dig into those details later in the call, in the discussion. But Robert, as we think about activating the safety net, so that it reaches out to you, what are some things that you're doing in Michigan or that you're excited to see happen in the future?
Yeah, thanks. First, we are blessed in Michigan to have wonderful partners. For a long time, the state has partnered with an organization called Sevilla, which is an extraordinary leader in this space. In the last year, we've been delighted to partner with Trooper and BDT, and I think states have huge opportunities to build capacity, and great partnerships are critical to doing that. So how are we expanding access and reaching out to people? We use technology is critical. Michigan has a really good portal. Check out My Bridges. It is a really easy to use portal. You can get access to all the benefits to which you're entitled or not all, but all the benefits you're entitled through DHHS in that portal. It is simple. It is easy to use. In this administration, it has always had SNAP and Medicaid. We have added WIC, so it's one portal that opens a lot more doors. So that's the doorway. Now we're going out to people and saying, hey, come in the door. So we're working with BDT on text messaging. We're texting people who are on Medicaid but not SNAP to say, hey, you may well be eligible for SNAP too. That has gotten so far a 7% increase in applications from the people we're reaching. Working with BDT, where we've identified 300,000 people who we think could be in WIC based on their SNAP and Medicaid enrollment but aren't. And we're going to begin texting them too. And finally, we use technology broadly to balance efficiency with the human touch. So I think most people who come to a state agency, they have a need, they know what they need, and they want to be served as quickly as we can. It's like anyone going to the DMV, and it's our job to serve those people as quickly and effectively as we can, not to lord things over them, not to ask questions that we don't really need answers to. Then there's a group of people who come in who actually need more profound help, and we want to be able to serve them. And I think thinking carefully about technology gives us the ability to do that. We've had to rethink with COVID. And so with COVID, we sent everyone home. We learned that many of our staff could work effectively at home. And that's going to be a great opportunity for us to save money and to be more efficient over time. But at the same time, we want to have a presence in the community. And so we're thinking about how to sustain that, how to maybe have more smaller offices, fewer people in them, but more reach in the community. Because technology is going to always matter, and it's going to be a way to reach out to people. But there will be people who need and want that face-to-face. And even in a tight budget environment, we want to be able to continue to provide that.
Great. And I want to encourage our live audience to use the platform that you're watching through to submit questions for our panelists. But Janette, can you tell me a little bit about, when a technologist comes in, what's the tools, the frames, what are you thinking about as you tackle these problems? And what would it take to get the technology tools and the technology really mentality taken up by every social service agency in a productive way?
Absolutely. I want to plus one and reemphasize some points that Trooper and Robert brought up, and I'll state them this way. Number one, we have to keep the people and the families that we're aiming to serve in the forefront of our minds, and that really is user-centered design. And the second thing is, I'll state, I think Robert talked about analytics, and really I think I would interpret that as we need to evaluate our priorities. We're always looking at what is the highest priority, and our highest priority is helping the people who need help in a timely manner. Yes, fraud can be a concern. Yes, spending taxpayer money is very important, but these things need to be in balance. And so here at US Digital Response, what we've noticed, and with all technologists in this space, we are here to partner with our government partners to turn these two principles into real practice. So for example, actually similar to Michigan, the state of New Jersey, we worked with their Department of Labor and partnered with them to create a simple and single website for their Department of Labor to help people understand what are they eligible for. There are about 15 programs that they offer, and if I am newly out of a job, or if I am taking care of a sick family member, how do I know what I can access? And so we worked with them hand in hand to build a benefits eligibility screener, I think similar to what, again, Robert Gordon talked about for Michigan. And to the question of how can more states do this? Well, we find actually a lot of our partners have this mindset. They do think a lot about their constituents and their residents. The problem really is that they are underwater. Their staff is underwater. They don't have the time to think through how to build a new program, especially in a time like now. And I think the thing that I would hope for going forward is the ability for local, state, and federal government agencies to have more open lines of communication, to clarify policies, to talk about priorities, to feed back what they're seeing in their communities on the local level back to the federal government, such that we can tweak policy and we can talk about priority and really what are the right metrics or accountability measures that each state should be actually held accountable for during this time of crisis.
Great, thank you, Janette. And your answer actually, I think, plays well into our first question from the audience. How can we assure a rollout of new technology and policy at the federal level? This is from Dr. Lucille Pilling from the United States. And of course, these benefits are federal benefits for the most part, but it's generally states that are responsible for getting them to people. So there's an interaction between the federal government and the state government that's happening here. Robert, I'll ask you to tackle this one first.
Yeah, I think that the new Congress has an opportunity to do something very helpful here. I think technology is very challenging in state government. It is costly. There's pretty generous match, but coming up with the state share is really hard. So I think more funding as part of whatever relief is coming from the feds, and it just can be general relief. I think we will use it and other states will use it to improve these platforms, and that will make a difference. I think alongside that, there is a need for support. I talked about BDT and Sevilla as two organizations that offer incredible support. I think every state should have the opportunity to work with partners like that. It accelerates your work and it can build a muscle. I think when it really works, it doesn't just, it's not consultants who drop in, help you out and then leave, and then you got to hire them again in a year. I think with the right partners, they come in, they build a muscle, you develop capacity, and then you learn to spread it within your organization. And I will say, just I'll close here, the expertise that we have built in user-centered design through our work on My Bridges, we have our leading expert within the department who sort of learned with and alongside Sevilla. He's now working on improving our communications for a vaccine because it's the same issue. How do you enable residents to have easy access to the tools they need to help themselves?
Terrific. And Janette, from a tech perspective, what can the federal government do to help, and what are some of the tools and tricks that could get all 50 states delivering at this level?
Yeah, I think the key beyond the funding piece is collaboration, as I mentioned. When states and local governments are issued, their policy doc, or they get to read the policies, there's a lot of confusion often how to implement or interpret that policy, and how can we enable the local governments, state governments, and federal government to say, let's work through these issues. For example, with PPP loans, who is eligible? How are they supposed to prove that their money, this loan was paid out in payroll if it is a cash-based business? And for those of you who don't know, the minority small business owner is more likely to be a cash-based business without payroll software that says this money is for payroll, right? So it's issues like this that need to actually be fed back up to the federal government very quickly and clarified.
Mm-hmm. Great. And Trooper, I'll let you take a stab at this. And I know BDT has a strong policy support role, and that you're also working with a number of Sevilla and other organizations in a coalition to provide some of the advice and tools that are needed.
Absolutely. So I think, first of all, there are a number of things that the federal government can do to enable states to procure the right type of technology and solutions. But frankly, that requires a hard look at the legacy approach that has been taken at the federal level that has provided nudges towards systems that are too inflexible, perhaps financially unsustainable. And so really looking at how to put the states in the best position to be a smart and adaptive customer of the new tools and techniques that are available and on the market today. But the second part now, I think what was just mentioned is very important, is in the design of policies and programs, is to keep in mind that to make them as simple as possible for states to implement. And BDT does a lot of really great work of helping states work through and how to tap existing policy opportunities. But we can design things better at the federal level. One thing that we would like to see is a one-touch approach to benefits, where if you come through the door, as was mentioned earlier, because of a need for one benefit, that the information that you provide and the application that you fill out should be applicable and relevant to a suite of benefits, so that we don't put unnecessary barriers in front of people to tap those things. And more important, and as importantly, that we are not wasting resources at the state and local level where agencies have to create administrative redundancies to manage different programs.
Great. And let's turn to another audience question, and I'm hoping we can get the right one up here for our tech team, about culture change in response to the COVID-19. How did your organization manage culture change? I'm ad-libbing, so what we have on the screen is actually not matching what I'm saying. But we had a question from the audience about how that culture change, how the organizational change and business continuity was managed. Robert, I'd love for you to lead off, and I know you may have to leave us in the next few moments. So, what have you learned, and how did you manage that?
Yeah, I appreciate it. Thank you, Kevin. And you ad-lib because I asked you to ad-lib. So thank you. And I apologize for dropping a little bit early. Culture change is critical. And I think there is a fundamental shift that we have all talked about, which is between government as sort of a hockey goalie that's trying to keep people out, and government as an enabler that's trying to help people move forward. And that's a big shift. And you need to drive it not just with policy, but by honoring the people who you work with. I don't think it is possible to treat members of the public with dignity and respect unless you treat and honor the people who are part of your team, and your staff is 14,000 people at MDHHS. And so a big part of what we said when we began was how much their work matters and how critical it is. And we even created a branding around hope, and it sounds hokey, but the H is for human dignity, and the E is for ease. And those came to be meaningful principles. You see them around our offices. We got 100 offices there, in every office. And so when COVID hit, I think people understood that it was our job to help. And it was not our job to worry about, do we have every last piece of paper, because someday an auditor might come and ask for it. It was our job to worry, there is a human being who lost their job, it's facing, can't put food on the table, and they need help right now. And I think when you talk in those terms, and when you use symbols to reflect those terms, and then when you honor your staff and you deal with their problems. So like, I spent a lot of my first year like worrying about reimbursement process, because there's this crazy thing where staff were asked to like front money for the state before they had to do state work. And it sounds like a really trivial thing, but like, you shouldn't ask someone to do that, not a public servant, not someone who's making a middle class wage. So you start with that, you treat your people with respect, you build out a culture that's built around ideas of human dignity and ease. And I think, not everything's perfect, but you make very real progress.
That's a terrific reminder. This is about getting people help. It's about making the citizen seeking help, empowering them, giving them dignity. But it's also about empowering the hardworking social service workers who are trying and letting them help people, letting them solve problems instead of doing paperwork. And tech can help with that, and good design can help with that, and good policy can help with that. Robert, thank you for such a powerful close. I know you may need to drop off in the next few minutes, but we appreciate you joining us for that. Janette, I'd like you to pick up in Robert's charge a little bit and respond also to the question from Heather Alvarez has posed, which I think is a really important one, which is culture change and change management. Two things that I know that you've thought about a lot is, one, how do you measure the right things? And two, USDR is there for government when they're trying to make incredibly difficult changes. What are the supports that you can provide, and what are the sort of leaps that need to happen?
Absolutely. I want to touch on that second point first, since it really builds on what Robert Gordon was talking about. In a time like COVID, we know that everyone's stressed. The public is stressed, and government agencies, the people at the government agencies serving the public, are stressed. They're going through their own personal stress, as well as having to manage going remote and figuring out new processes and likely staff or hour cutting, budget cuts. We at U.S. Digital Response, we were born in COVID, and this environment shaped the way we think about how we serve our partners. It's in our principles to meet our government partners and our nonprofit partners where they're at. And what that really means is, we're here to alleviate their stress, to help them further their agenda in how they serve the public. And to that end, we are listening to what they need, what they know their people need, and we are helping them and working hand in hand to craft a plan, or to build a tool, or to create a social media campaign, whatever it is that they need to do their work the best.
That's terrific. And I think we're ready for another audience question, or maybe not. Trooper, reaching people where they are in modes of communication. Someone locked out, we're talking about data and tech tools. Does that mean you have to have access to the internet? I saw that BDT now has a chatbot. What is that for, and is there a risk of leaving people behind?
There is absolutely a risk of leaving people behind, and I think it's important in this work, and particularly as we are using the best and most recent available data and technology tools, that we're honest about the biases and blind spots that can bring. We can serve many people through texting and helping them move through the screening and application process, but that assumes that you have access to a mobile phone and regular service. Chatbots are an extraordinary way to serve more people in a more convenient way, with a lower administrative burden to answer the questions and move people through a benefit and understanding of how to apply. But again, that does assume a level of digital comfort and savvy. And so what I think what we really want to do is to build a system where we can, again, serve people the way that they want to be served, as a foundational point of dignified service. For some, that might be texting and using chatbots. Others may want to call and talk to someone, like my amazing colleagues are in my benefits BDT's contact center. We have this extraordinary group of benefits outreach specialists who provide some of the most sophisticated, high touch and caring support around. And other people may want to talk to a community organization or someone in their neighborhood who they know and trust and who knows them. And for example, our work in Philadelphia, yes, we use our data and technology and contact center tools, but the core part of that, working with the city of Philadelphia, is an extraordinary network of community organizations across the city, so that people who who know those organizations and who trust them and who are known by them, they're the interface and can get people into benefits. And so this is really about, treating people the way they want to be treated and serving them the way they want to be served.
Yeah, I have to say, listening in on one of the calls of your benefits outreach specialists, the way they serve people and the feeling of satisfaction on the other end of the line is a really powerful thing. We have another audience question coming up, and I think it's a terrific one. There are lots of platforms that want to connect. USDR emphasizes serving people in timely fashion as a core value, and user-centered design is a key tool for getting there. How do we get underwater agencies to adopt new tools and practices? I'll send this to you first, Janette, and talk about the interface and how this gets done.
Yeah, thank you for that question, Justin. I really think it comes down to two things. One is funding. These agencies need more staff. They need more money to be able to hire that staff. And so funding is a really big part of it. Outside of funding, the second one is the ability to partner with agencies like U.S. Digital Response and ideally be able to share information with other state agencies or other agencies going through the same issues in order to drive to clarity. I'll talk a little bit about the second one, U.S. Digital Response. What we find is when we partner with agencies, when they have the time to let us in, what they really need is to know that we are not here to sell them anything. We are not here to convince them that they need really large builds and really large vendor contracts. We are evaluating their situation first and foremost from where their systems currently are, what they currently have, and what their end users really need. And so we're looking for ways to, in a more iterative fashion, develop the programs and the technology to get them what they need.
Awesome, and thank you, Justin King, for the terrific question. And I think, to add to your point a little bit, Janette, a couple things that we've learned is, one, although more funding is needed, it's important to understand that funding going to administration is not wasted if it's connecting more people and helping more people. And secondly, that doing things differently doesn't have to be expensive. That agile development, using open source tools, that implementing these tools in a different way can actually save costs over the long run. Trooper, we've got another question from the audience for you. There are a lot of platforms that want to connect people in need with services beyond government programs. These include 211 programs, Unite Us, NowPow, and others. This is becoming difficult as participants with services are being asked to add and update their information in multiple platforms. Is there a way to streamline this effort by using technology? This is from Phyllis Alberton.
That's a great question, and for we are very interested in how to work with platforms such as this to add the benefits screening functionality and value to those. But you raise a very good point that, again, we need to remember that there are individuals, there are human beings at the other end of these platforms, and to really think about how to make it as easy as possible for them. My mind initially actually doesn't go to a technology solution. I think it's really a process and organizational approach, and to have the the conversations with the customers, and bringing in the voice of the client, and what is the most common sense way to engage them, and to think about that someone may be going to one platform through their state government, there may be another with their county and local, and then others through nonprofit agencies or school districts, et cetera. And really to have that deep conversation about how does someone balance all of these things and get the most out of them without being fatigued and frustrated. That's a great question of a conversation that's probably a bit past due to have.
Terrific. So I'd love to talk about a little, to dig into data science and how, agile development methods, which I know that the two of you are variously interested in. Tripper, how does BDT use data science?
Well, data and how to, and more importantly, how to effectively use it is really at the core of what we do. First of all, the issue around data matching is so important to be able to find people who are most likely eligible for benefits and not receiving them. And so that starts with our working with states and others and helping them be able to tap the rich data that unfortunately sits across agencies and stovepipes, and to be able to see if there are people in one benefit, say such as Medicaid, and how to break down those barriers between data sets to see who's not receiving other benefits, and then allowing us to engage them and help people get them. You know, I think there are a few things. I think one, and of course it's important, or it's easy to get a bit too caffeinated with a conversation around data science and to take things off into the stratosphere, when in fact really data science and various tools and techniques are really grounded in some very practical things. It allows us to be smarter and more efficient with serving the people who we serve, to gain insights on the communities that are easy to underserve and that can exacerbate racial inequities and other forms of inequities, and how can we use data science responsibly and keeping in mind issues around ethics and bias and other matters, to really do what we do better and more effectively internally. Externally, I think there are many things that we can be doing to not only serve people better with benefits, but to glean the insights around the effectiveness of benefits, the impact that it is having, that can allow us to make the case for strengthening and improving these programs, and that can frankly also help us really get the type of insight to get to the hard issues that's keeping too many communities behind. Now let me make it clear. I don't want to say that the only reason why things such as racial inequity and regional, and there was an earlier question about the urban-rural divide, is not just down to lack of insight and information and analytics, but the information analysis that comes with that can help us find smarter solutions to make the better public policy and other decisions to hopefully make progress on some of these seemingly intractable challenges.
Terrific. I think it's important to realize that these programs aren't charity, they're also investment in people's futures. Lightning round to close those out. What are you looking forward to in 2021? Would you like to see in 2021? Janette, let's turn to you first.
Number one, policy and iterative and collaborative development towards serving the people.
Terrific. And Tripper?
I would say some common sense, good old-fashioned common sense that, my folks back in Michigan applied to many things. If you take an issue like benefits access, we're really talking about common sense. Just make government work the way that it should. Make these programs work the way that they were intended to work. treat people who are facing challenging circumstances, and in some cases, generational and systemic challenges, treat them the way that we treat people with more resources and comfort. And one thing that I love about this space is that, you know, now we talk about so many structural challenges and systemic issues that it can really seem almost overwhelming. And by applying a good dollop of common sense to making our benefit systems work, we can fix this. Like we can actually make sure in the next year or two that every senior citizen who is eligible for SNAP, for hunger assistance, and who wants it can get it. We can make sure that students who are eligible for Pell Grants and federal financial aid can get it easier so that they can get on with their education and make their way. And by the way, make sure that our economy can grow and innovate. Like, we can actually do this. This is a solvable challenge. So common sense.
We can fix that. I think that's a great note to take us out. And I want to thank our audience for tuning in today. We had people from across the U.S. tuning in, folks from D.C., Grand Rapids, Michigan, Wilmington, Austin, Texas, Maryland, San Jose, Vermont, Colorado, Phoenix. So this has been, you know, a nationwide conversation. You know, a few messages to take away from this. One, that this is not about just efficiency or sort of improving, making a better widget. It's about empathy for other people. It's about investing in our fellow citizens and making sure they have help when they need it. It's about equity, and it's about building confidence in government. That the government will be there when you need it, that the help that has been allocated will be there, and that you'll be able to access things when you need it in a pandemic or in more normal times, without having to jump through hoops and in a way that leaves you feeling good about the experience. And that the tools are out there to make this change. Not only do we have a lot of people in government who are leading the way and doing innovative and exciting things with data, technology, and design, but there are organizations like U.S. Digital Response, like Benefits Data Trust, like Code for America, like Georgetown University's Digital Services Collaborative, like New America's Digital Innovation and Governance Initiative, and many others that I could mention. The tools are out there, they need to be used, and it's a matter of working smarter and focusing on what matters. Thank you, Trooper. Thank you, Janette. And thank you, Robert Gordon, for joining us. And thank you very much to our team behind the scenes and to the audience out there for spending some time with us to learn about this issue.
Thank you so much.
Thank you, Kevin.